Welcome to Burning the Couch with Pim and Micaela. Although we are licensed therapists, please note that information in this podcast should not replace psychotherapy, clinical supervision, or be taken as legal or medical advice.
Privacy is important to us, so all people, places, and scenarios mentioned in this podcast have been changed to protect client confidentiality. Also, we don't condone literally burning your couch. And a special thanks and shout out to C-Cop Studios for the awesome music we're using in this podcast. Welcome to Burning the Couch. This week we are going to be focusing on what nobody tells you in the helping profession, the mental health field, being a therapist. For those of you that have been in the field for a while or are more seasoned therapists, you can probably relate to a lot of this. And this is also great for people who are new to the field, just entering the field.
Run away.
No, that's not what...
Just kidding. Maybe.
Or even people who are considering or interested in becoming a therapist and helping people in this field.
Yeah, I think there's a lot that I wish I would have known about being in this field that no one really told you or really prepares you for.
Right. School can only do so much.
It's one of those things where you just have to be in it.
Right.
I think for you to really know.
Right.
So the first thing is a really big one, I think, is not getting acknowledged for all the work that you do. And I think this probably applies to all the other helping professions out there too, nurses, military service members,
Doctors, first responders.
Yeah. This applies to everyone in the helping profession where you don't really get the instant gratification of your client saying thank you or even seeing change. Sometimes you don't get to finish what you started, especially if you have a limited number of sessions or maybe the client stops coming, moves away. It's not as easy. And I remember, prior to grad school, I was working many jobs, whether it be an office assistant or being a server, and you get to have that immediate feedback. You get to finish work at the end of the day.
Yeah, completion, right? I'm done with my shift, or I've just dropped entrees off. Everybody's happy and been fed at all my tables, right? And many times we're just planting the seed for our clients.
Yeah.
Right.
And then sitting with the uncertainty, I think, of not knowing what the outcomes would be, not knowing if this is going to work. I think that's really hard for a lot of perfectionists like myself. I remember when I started my traineeship, I sat with my supervisor freaking out because I was like, I'm not sure if this is for me. Like I don't know if this is good or if I'm doing good because I'm so used to like being an A student, like finishing a project, getting a grade back, and this is definitely not it. You kind of just do your job, and you don't know if you're going to get a gold star or not.
And you might not get that gold star, and being able to still go to work and still have that empathy, still have that that drive and that passion for helping people. When you're new and you're entering the field, I think you think like, oh yeah, of course, this is why I'm getting in that field. I want to help people. I'm passionate about it. And then we lead to burnout when we're not getting gold stars,
right.
Or it's building up and it's hard to handle some of our own stuff as well. And so I think, in school they talk a lot about burnout, but that's one of those things that
Go get a massage.
do yoga.
Do yoga. Take deep breaths.
and you think you get it, but you don't unless you've experienced it. And once you've kind of had that experience and learned how to get through those experiences. So I would say one of the most important things is that you have to learn how to handle your own shit.
Yep.
You have to be able to balance empathy for others. You have to be able to handle your own emotional responses. especially when you're hearing some really awful things sometimes in sessions, and being able to set limits. So, you know, there's a lot of things that I wish I would have known, and a lot of it as well is about personal growth. You will grow so much in this field. You'll learn what your limits are, right?
And it's different for everyone. So yeah, like school does try to teach you about burnout and how to deal with it, how to manage it, but everybody's burnout looks differently and everybody's self-care looks differently. Just as everybody's own emotional responses and limits are different. So it's not something you can train for, I think. Or learn or read from a book. It's definitely something where you have to figure out along the way. And that can be hard for a lot of people. Like myself, I had to kind of readjust my entire view of how I do things because I was so textbook oriented and just, you know, I learned this one way and then I'll do it the way I learned it. But this is something where I had to figure out along the way, and that was hard for me.
Right. I think even just learning how to go with the flow.
Yeah.
Right. Whether it be in session, whether it be certain techniques, whatever it is.
Yeah.
Really having to go with the flow and
working with kids help with that. I mean,
you can't really have an agenda.
you think you're going to do one thing and then they come and then you're just like, nope, we're not doing that today.
You know, so I think even through some of those more difficult things like burnout and dealing with our own stuff, because, I mean, we have it, right? We're human. And all of those things really add up to being able to have this personal growth that you have that in other professions too, but this is a little different, right? Like we're dealing with people's lives and also managing our own.
Yeah, for sure. I want to talk a bit about imposter syndrome.
Oh my gosh.
I actually think I've never heard that term during graduate school.
No. And I think I still have it.
Yeah.
Sometimes I'm like, oh my gosh, they're going to find out I know nothing. They're going to find me out and never want to come back. Or even my employer, sometimes I'm like, oh my gosh, we're in a meeting. I'm like, I don't know if I know the answer. What if I mess up? Or what if they find out I'm a terrible therapist and I know nothing? Or, and I don't know if that ever goes away.
I don't think so. I mean, there's probably people listening to this podcast that have been doing this for much longer than we have. Do you guys have the answer? I don't know.
Yeah, I mean, I remember in the beginning of my practicum traineeship, one of my supervisors was like, they're not going to know it's your first session. Yeah. They don't know what you're supposed to know either, right? So no one's going to know that you're like a brand new therapist unless you tell them. And like it's your first session ever. I'm thinking back to my very first session. I'm like, oh my gosh, they're going to think I'm an idiot. I don't even know how to fill out the paperwork. And she's like, they don't know what you're supposed to do either. You'll be fine. Yeah. Just to kind of ease my anxiety around it. And
I think I made it pretty obvious that I was new because I was like, I don't know how the system works. I don't know what form I'm supposed to fill out.
Right.
They're asking me, where do they sign? I'm like, let me look.
So, I mean, she said that to ease my anxiety. And at the same time, I'm like, years down the road, I'm still like, I don't know what to do in this situation, or gosh, I don't know how to respond. And I think that's okay,
I think you get more comfortable with it with time. I mean, lately I've had some clients who, they're my longer term ones that I've seen for 1.5 years, almost 2 years. And sometimes they go through something temporary, but something difficult. And they ask me what do I do about it? And sometimes I'm like, I'm going to be honest with you. I don't know. I don't know. I know that if I were in your shoes, I'd be stuck too. And they do appreciate that. They appreciate the honesty, and what I'm providing for them is space and sitting there with them and supporting them through something difficult. But sometimes I don't know.
I think that's kind of the beauty of this field as well, is that it's not such a routine job where you can go on autopilot And
oh, absolutely not.
You know what I mean?
It's definitely not a job where you can come in hangover with like a hangover.
No.
You need your brain at full power.
Exactly. But I think that's kind of the neat part about it, is because every day is so different. We're dealing with different people every day. Mm-hmm. We can't predict how session's going to go, right?
Yeah.
And so I think that's kind of the neat part that requires us to be able to go with the flow and be flexible in a lot of things. And, because it's not this routine job of, okay, this is exactly what I do. So, organized and strategic in that way of routine, it allows us for more growth, and it keeps it interesting.
Sure. It does.
It might not be, I know exactly what to do. We might have to sit with that discomfort, but it's kind of like,
yeah,
I've pro and con.
Yeah, I've definitely grown as a therapist. When I was a trainee, I remember planning out my sessions, because we were so used to learning about theories and models and interventions. So, I would sit and I'm like, okay, I'm going to land these interventions today. I'm going to use these games today or do these activities with my clients. And I would sit and do all these things, but I think I've grown so much, in reality, I don't do that at all anymore. I mean, unless it's, a client specifically was working on DBT or something where we were doing concrete skills training. But I would say 90% of the time, it's whatever they bring into the room that day, that hour.
Right. Even manualized treatment is going to be flexible to an extent, right?
Yeah.
So the imposter syndrome, I don't know. I wouldn't say, we're still under 10 years in the field. So I can't say that 20 years from now, I'll still feel imposter syndrome.
We'll keep you posted.
Right. I feel like many people do, though. There are times and points in their career where, I don't know what to do, or, oh my gosh, I don't even know if I can answer this question, or do I really know what I'm doing?
Yeah.
I think those thoughts are always going to come up. But did you have something else you wanted to say about?
Well, I was just going to say, I've spoken to people who have been in the field for 10 plus years, and I think sometimes they get stumped just like we do. Mm-hmm. I think everyone reaches that at a certain point, because it is a field where you continue to grow as a clinician and things continue to change. I think I don't know, if someone has other ideas about this, we'd love to hear feedback from our audience. But, I'd be curious to hear from somebody who's been in this for a very, very long time. But my guess is that it does get better, and that you've learned how to sit with feeling like you don't know things and feeling inadequate.
Right.
I think
which is what we tell our clients, right? They're like, they come in, they want the answer, and we say, well, there might not be a clear answer, right?
What am I paying you for?
Right. And so it's kind of like, we also go through that too, of we might not know the answer, and that's okay as well.
Yeah.
Right. One of the big things I think that falls in this topic of what nobody tells you, and again, this is going to vary from job to job, from field to field, whether you're social work or MFT or
LPCC.
Yeah, this is going
all the different A, B, C, D, E.
Right, or if you're
license.
Substance use counsel, this is all going to vary, as well as where you're located in the world.
Right.
But what they don't talk about nearly enough is pay.
Not at all.
This is the hot topic.
Yes.
Pay.
No one talked to me about pay or salary. You can look it up. You can Google it. It's not accurate.
Definitely not accurate.
I remember, I looked up average MFT salary, and it was around 70 to 80,000. And then I called bullshit on that when I became an associate. Professors feel uncomfortable talking about it. They don't tell you straight up. Honestly, when I became an assistant professor and I taught my first theories lab, I was shoot me with questions. Ask me. What do you guys want to know? And someone was kind of jumping around the question. And I was like, are you curious about how much money you'd be making? And they're like, yes. And I'm like,
especially as unlicensed,
as
right?
unlicensed,
That's
right.
so
I was
such
like,
a gray area.
Great. It's okay. Like, I knew you were trying to ask me that question, but you were too afraid to ask. I will tell you how much money, like, my colleagues and I made as unlicensed therapists, how much money we make depending on, what the jobs look like out there and how much money they'd be offering, because no one talks about money. Like, they all feel uncomfortable about it. And for me, it's like, well, if I was in their shoes, I wish someone had told me.
Right.
And I, like, right, where I'm at right now too, I have a boss who's like really, really open in talking about money and student loans and how much she's paying things back. And I appreciate that, because I think everyone is in the same boat of not knowing and feeling anxiety about their financial security or the future of their finances, but like no one's talking about it. So, it just, why not be helpful for the next person?
Right. And I think this definitely depends on whether you're licensed or not, whether you're working in an agency for the county or whether you're in private practice, whether it's your own practice, whether it's a group practice and the owners or the bosses are taking a cut, of your session pay. Like, this is something that, we get into this field because there's a reason. We're passionate about it. Maybe we had a therapist that we really connected with and we're like, we want to do that. We want to help people. And it's a very like noble kind of field, I would say. And also there are many positions that are not compensated for the work that you're actually doing.
Well, I think helping professions in general, you're expected to not do it for the money. You're expected to just, be helpful and be supportive. That's bullshit. Like, I know money.
I also like to eat.
I also want to be able to afford self-care things.
Right.
But I think it's that topic that makes everybody uncomfortable. Yeah, money doesn't buy everything, but I don't think we should feel guilty for wanting to make money. And I mean, as long as it's like ethical, you're not charging like $1,000 a session. But I'm saying I don't think we should feel guilty about wanting to make money or being financially successful or stable in this field. I think there's a big misconception out there and a big stereotype of like people in all helping professions of, you should feel guilty about wanting more money. You should, not want to accept more because, this field's about helping people.
Right. And, it's kind of...
that's why they underpay you.
It's one of those things, too. It's like you have to have this degree. You have to have higher education to work in a lot of these positions. Most of them, if you're doing therapy, right? And that costs money. And then you do your traineeship, which my traineeship while I was in school, that was like a full-time job.
Yeah. Right?
I was working at the clinic and going to school.
Yeah.
I didn't have time to work a job where I actually got paid. Right?
So
I had to live off
right.
of loans, right? And now I have to pay those back.
Well, also, they would say you only need to do 10 to 15 hours a week, no more than 20 for your traineeship. But that's bullshit, because even if you have 10 client hours a week, that doesn't account for you being in a county funded site, so you having to do all the paperwork, which amounts to like 25 to 30 hours a week.
Yeah, plus then add on like 3 different classes.
Yeah,
and, you're right.
And treatment team meetings.
Right. So I think that's one of the things is that it was kind of a privilege for me that I was able to use student loans so I could just focus on school and my traineeship. And I had to use that money to live off of it. And now I have to pay it back, right? Yeah. So it's like I need to make more money.
And all the extra things that comes with it that no one tells you, right? Like having to pay for licensure, having to pay for exams,
CEUs.
registrations, CEs.
The licensing exam itself and the study material. It's insane.
Yeah, if you want to specialize in something, then you have to pay more money for those things.
Every year. Mm-hmm. Those letters behind your name you pay for.
Yeah. So while we're on that topic, right, I think associates and interns, trainees, I mean, you're free work is what you do. But for associates or interns, which is post, and we're talking specifically with MFT because that's what we are. So that's kind of what we know. But I'm sure there's similar processes for other counselors and therapists out there too. But I think when you're unlicensed, your pay is so, it's like you get cheated out of your pay with the amount of work that you do. And I don't know if anybody else feels this way, but I know for me, I mean, it depends. It varies by agency, but I do know that a lot of agencies underpay their unlicensed therapists, at least where we're located, because they, either don't have the experience yet or whatnot, but they're also doing a lot of work.
Yeah, and there's
for a bachelor's level pay, I would say.
Right. I made more money in a bachelor's level job than I did starting my very first job outside of my master's program.
And there's people who were from our cohort that made even less.
Yeah.
The lowest that I've heard from someone in our cohort was they accepted a position for $17 an hour. And
I see 15 all the time. And
I see
we're
15
in California.
posted, too. We're in California, so just keep that in mind.
Minimum
too.
wage right now, and this was a couple years ago. I think it was probably like $11 or $12 an hour at that time.
Yeah.
Right?
So that's barely a few dollars above minimum wage for having a master's degree.
Right. Mm-hmm. And so, I mean, I think this is something that's real. I think especially in our field, we're very timid when we're applying for jobs or we're interviewing or there's an opportunity to negotiate for pay or ask for raises. And I mean, yeah, it's super uncomfortable.
And
right?
the area we're at too, we have a lot of, I would say saturated with therapists, mainly because we have a lot of graduate schools for therapy here. So I think there's a lot of people also fighting for the same positions and people that are willing to take lower pay. But know your worth, honestly. I think I'm much more comfortable as I'm becoming more and more, I guess, confident in my skills and my abilities, that I know what my worth is. I'm a registered play therapist. I'm licensed. I have all these experiences under my belt. If I were to go somewhere to want to work in agency work again, I think I would be able to advocate for myself more than when I first started, because I was just taking whatever that they were offering.
I think initially too, everyone's so eager to get hours that it's like, okay,
they'll take
whatever,
anything.
I'll take $15 hour job. I just need to get my hours so I can get licensed. So it's really up to what's going to be the best fit for you. But I think as a whole, our field does need to start asking for more money, as uncomfortable as that is.
We need to pay our therapists more. We do. I mean, like I've had a position as an unlicensed therapist at an agency where I was making more than what a supervisor was making at another agency who was licensed for years.
Right.
And of course you have to work out benefits and whatnot too. But I think overall, in general, we do need to be able to advocate more for ourselves.
Right.
And I mean, I can go on and on about mental health in America, but yeah, I do think this is something that needs to be talked about.
Yeah, and
maybe we'll do an episode on it.
Oh my gosh, yes. I think just to kind of touch on that a little bit further is many times if you're in a county agency, they are only allotted a certain amount to be able to spend. And then in private practice, it's a little different, because if you're working in a group practice where you're charging the client a certain amount and then you only see a certain amount or a certain percentage, right? That can be a little frustrating as well. And having those feelings of gosh, I'm charging these clients this amount of money, and clients don't know, and they shouldn't know this piece, right?
Yeah.
In detail of how much my therapist is actually getting paid.
Right.
But that can feel gosh, I feel so exploited. I feel kind of like cheap labor. And, also considering that as an unlicensed clinician, you do take some resources from an agency or a practice, right? With whether it be supervision or consultation or whatever it is, there are some resources with that. And also, it doesn't mean you can't ask for more or negotiate or, know your worth.
Yeah,
Right.
for sure. The last thing I'll speak about in terms of pay and salary would be probably insurance. I don't think people have really talked to me about at all. I think when I was in grad school about taking insurance as a therapist,
Or how to even do that.
yeah, how to get on insurance panels. I now know that you definitely get reimbursed more if you're a doctoral level, clinician, whether you're a licensed clinical psychologist or whatnot. Well, you definitely get more if you're in the medical field, so if you're a psychiatrist. I think master's level clinicians, we don't get as much reimbursed from insurance. So now I kind of understand why a lot of therapists don't want to take insurance, which sucks because like clients are paying for insurance. They want to be able to use it. We're not getting reimbursed sometimes like 3 months later, and we have to fight for it. And all of, don't even get me started with the whole covered diagnosis part. So these are some things that like really no one told me about that I'd have to deal with. I mean, I remember talking to my mom about, in the future owning my own practice and doing all these things. And she's like, oh yeah, I mean, you can just take insurance, right? That's where a lot of your clients will come from. And then finally being at a private practice agency now, looking at how it works. And I'm like, I don't know if it's financially makes sense to take all insurance clients sometimes.
Yeah. And when I think it was maybe my second year into my bachelor's, I was thinking like, this is what I want to do. I'm a psych major. This is my goal. And I interviewed a licensed marriage and family therapist in Southern California. And I interviewed her and I asked her, like, what piece of advice would you give someone that's new to this field or considering getting into this job profession? And she said, don't take insurance.
Yeah.
And at the time, I'm like, that's so far beyond what I was thinking in my
Right.
head. I'm like, I just want to help people. This is so exciting. Human behavior. This is awesome. And that was just, someone did tell me, right?
Right.
And it didn't make sense until,
Right.
again, you're at that
Until you're
point.
in it, yeah.
Yeah. But insurance does make it a little trickier sometimes.
That can be a whole nother episode for us. I can go on and on about,
That might be a rant.
it
An
might be a
insurance
rant. It might be a rant, but I don't know. Well, we'll talk about that. The next thing is liability. I think that's a big one. I didn't know all the things that we can get sued for.
This is scary. I don't like this topic.
This is a scary one.
I like to avoid.
I went to a law and ethics training for license renewal not long ago, and it was like a 7-hour training. I think I literally spent all day learning about the different ways I can get sued. It was not fun in any way. I think it comes with a lot of responsibility. Even if you're not working with high risk clients, even if your clients are okay, you still have certain responsibilities like keeping their information safe or secure, being responsible for leaks of information, knowing about consents, who can consent and who's signing the consents, like being up to date with laws because laws change all the time. So there's a lot of liability I think that we hold, that like we weren't really told of. I mean, we've all taken like a law and ethics class in grad school, but I don't think we know the extent of it until you're in it.
And that you have to pay for liability insurance, another thing to pay for.
Yeah, which I've learned at that training too, that you have to read and fine print. It's not something you can just purchase and be like, all right, don't have to worry about it till next year. It's renewed now. But depending on the plan or the liability insurance you have, some things may be covered and some things not. And I didn't even think about that.
Right.
Until that training.
The first time I bought liability insurance, I just was like, okay, I have it. I'm good.
Yeah, it's something I just need to pay for. Done.
Yeah.
But, you know, I think, again, this is something no one really talks about. And then the feeling that you get. The feeling of having to CYA. You know, like constantly making sure, like, did I document everything? Did I consult with people who I need to consult with? What did the treatment team advise? And like,
Did my note cover everything
Yeah.
it needed to?
Yeah, like having to think about, you know, possibly if this case goes to court, making sure that I have all my documents straight. It's a shitty feeling because that's the last thing that we should be concerned about is, like, you know, me losing my license or going to court, but we have to be concerned about those things. I hate feeling that way. I want to just be there for my client.
Right.
You know,
It's so much more.
Yeah, I don't think anyone has ever talked to me about that.
I don't think anyone ever talked to me about that either, actually.
Yeah.
I mean, we talked about, you know, we had a law and ethics course, but it wasn't to this extent.
Yeah. And I think as a trainee and as an unlicensed therapist, it doesn't really matter. It didn't matter as much at that time because it was like, oh, be on our supervisor.
Right. And, you know, I think in
Which
school,
isn't true, by the way. I want all of you guys to know that it's not entirely on your supervisor.
And it might just depend program to program too. I don't know. Typically, I don't think this is focused on because it is so new. It doesn't make sense. It's like, you know, years down the road, me learning like, oh yeah, when she said don't take insurance, that makes sense, right? I get why she said that now.
Don't click till later on.
And so I don't know if it would have done any justice of having a whole course on how to go about liability insurance and what you do about opening your own practice and, you know, marketing and those kinds of things. I don't know if that would make sense at that point.
Yeah.
At the same time, it seems like it's almost taboo to talk about.
Yeah.
Or pay, right? It's like that's such a taboo thing to talk about.
Yeah. Maybe there needs to be an elective course, like
the business aspects, right?
what it's really like being a therapist course.
That's our course. That's our new course.
Yeah. Maybe we'll open an elective class.
Oh my gosh, that'd be awesome.
Yeah, business aspect. That's a good one. That's one of the things that no one talks about either. I think depending on the program that you go to, it could be very county oriented.
Where you have a wait list for 3 months.
Right, like a nonprofit kind of, like they're training you to go into those fields. And some professors did. I know one of our professors from our program was pretty honest with us of like, you guys, I would say 90% of you guys are going to go into nonprofit agency work when you leave this program. So I want to be sure to train you to get ready for community practice. But for those people who wanted to open their own private practice, they had to figure it out along the way. Most of my cohort had to seek mentors, reach out and network to other therapists and ask them how they did it. It's kind of like learning a craft from, like being an apprentice.
Yeah.
Like learning from other people who came before you. It sounded very Jedi-like.
Right. And even though you work in a private practice, not everybody is willing to teach you how to open your own practice because they don't want to have more competition. You're going to be competition, right? So it's also finding those opportunities and mentors that are willing to kind of help you along the way, give you feedback and information.
Mm-hmm. One thing that I thought about was, it's a very quick one. No one told me that everybody wants weekend and evening appointments.
Oh my gosh, that's like the whole reason I got out of the serving industry. Because I wanted holidays and nights and weekends off.
Yeah. And you know what's funny is, and here I am again on my soapbox, it's when you make a doctor's appointment, medical appointment, or a dentist
appointment,
dentist appointment, Dr. So-and-so only has Tuesday at 2:00 3 weeks from now. Sure, I'll take that.
Right.
But that doesn't work the same way for therapy. I think people don't prioritize their mental health as much. I do have some clients who, they absolutely want their kids to see me, and they know that their kids' mental health is so important that, if their mental health isn't okay, they're not going to function in school. So they're willing to take their kid out of like an elective, for example, once every 2 weeks or something, just to get until they stabilize, so they can get some therapy. I've had some clients, use their PTO just to be able to come in, because that like 4:00 on Monday was the only slot I had. So there are some clients, I would say, that prioritize mental health. And of course, I try to work with my client's schedule, but that's not always possible.
Right. And I think it's a little different too, because the consistency needed for therapy for it to be effective is a little different too than some of the other types of appointments. Like, how often do you see the dentist, right? You're not going every week.
Yeah.
You're not going every other week. And so it's like, okay, well, I can't miss 11 o'clock, on a Wednesday every week.
Right.
So I think that's kind of where it gets a little trickier.
It is.
And at the same time, I also agree with you that it's not a priority for many people.
Yeah.
To actually, okay, I'm going to come in early so I can leave early, or, if you have abilities to do that and kind of tailor your schedule to making it a priority.
I mean, if you have to go to something every week, like once a week, weekend and evening,
that makes sense.
The most sense for a lot of people if you work a regular 9-to-5 job, or you have school. And then as a therapist, you also need to, time is money, and you need to fill in your spots, but that's where certain people can do it. So if you had college students, some people who work odd hours, or kids who have early release days, I mean, you make it work. But again, there are some feeling that I have of like, or even my clients who come in once a month for a check-in, but it's hard for them to schedule something, whereas I think at the dentist, like I said, not talking crap about dentists, I like my dentist, but it's much easier.
Right. And that's initially when I went in, I was like, yeah, I can make my own schedule. Mm-hmm. I can have nights and weekends off. I'm going to work like a doctor's. I had in my mind, it's like a doctor's office.
Yeah.
Right. And that's how it's going to be ran.
Yeah.
And, especially if you're really wanting to carry a caseload, if you're in private practice, you're going to have nights and weekends, or at least one of those, right?
Yeah.
You're going to have to sacrifice one of your weekend days or one of your evenings, if not a couple. And that's just kind of the nature of it, which, it's funny. I was talking to one of my professors, and she also was like, I didn't realize how many people wanted nights and weekends. And I was like, oh, well, I'm going to get into teaching at the university, right? So I'll be teaching during school hours and have nights and weekends free up. She's like, and then I realized all the classes are at night because everybody works.
Yeah.
So she's still stuck doing nights and weekends. But yeah, that's just the nature of it.
Mm-hmm. Case management. Let's talk about that. I think that's a big one that I didn't know I'd be getting into at all.
There's a lot of coordinating and
a lot of
networking
coordination of care.
And researching stuff and calling people
Yeah.
that nobody sees. Nobody knows about.
There's a lot of time going into the extra work, I would say, outside of that 1 hour therapy session. No one talks about it. No one tells you about it. Your clients don't see it. I know for...
Sometimes you don't get paid for it.
Oh, yeah, you don't.
Most of the time you don't get paid for it unless you're in an agency.
So, like, my husband used to say, like, I can't, like, imagine spending that much money for therapy. So here in Southern California, where we're at, the, cost of living is quite high. So our fees are around anywhere from like $100 a session to $200 a session I've seen. And I think that's the highest I've seen. But, I told my husband that these are the fees, and he's like, I can't imagine spending that much money. Like, who just has money to pay for that privately every week. And, you know, I had to explain to him, honestly, it's not, they're not paying $100 or $150 for 1 hour of my time. They're not. They're paying for me not just a session time, but researching treatment, writing up case notes, writing up treatment planning, coordinating care. This last week, I saw 15 clients, but I spent probably an extra 6 hours talking to the, like, you know, psychiatrists, school, you know, OT, like all the other different people that are involved in my client's treatment. And all those come with more notes.
Right. And I would say, especially if you're working in county, like the case management piece is going to be a lot heavier.
Oh, for sure.
I know that I was working in a private practice, but I was also working as a term provider, which I think I've spoken to before. But basically, that's a county-funded program of people who are mandated to treatment, right? There's a lot of coordination that goes into that, whether I'm coordinating with social workers, whether I'm calling regarding a psych eval and I need to talk to the psychologist. You know, that could last an hour.
Yeah.
You know, that I'm not getting paid for. Mm-hmm. So, and then I have to write the notes for all those conversations that have happened. Work. Yeah, there's a lot of that. You know, I would say that my experience, which is somewhat limited, I've noticed that in private practice, there's still a lot of that happening.
It's not as much.
But I am able to focus more on clinical work and being in the room with clients, which is what I would prefer.
Same.
So that's where I've noticed, you know, that's kind of a better fit for me in the private practice realm, because I can focus more of my attention in session. You know, I don't have these standard forms that have to be filled out. I have my own forms, and, you know.
And everyone's different. I have a colleague who has 2 jobs. One, she works private practice, and then her other job is at like a county agency part-time, because she wants a break from clinical work. She wants to just help some low income or clients with other needs to be able to, I don't know, get access to like an optometrist, or being able to get disability, or she likes that kind of work of being able to help people in another capacity, getting their needs met. And it gives her like a break from clinical work.
Right. And I think, you know, we see this in maybe other forms of the helping profession, maybe not MFT. We're trained to be therapists, right?
Right.
And sometimes people get into social work and they want to do case management, right? That is their focus. They don't necessarily want to focus on clinical things.
Or there's a social worker who wants to be more clinical.
Exactly. So I think kind of that's something to consider too, is that different degrees, different jobs might be tailored to something different, and keeping that in mind, especially if you know, are thinking about getting into this field.
Yeah.
Those might be things to consider.
And don't give up too soon. I think I was at an agency where I was miserable at. I was driving my clients to their appointments.
I hate driving. Oh my gosh.
Without support, when they're, you know, in the middle of a crisis. I would cook lunch or cook dinner for some of my group home kids. It's just not part of my job description. And, you know, I'd have to do various things that I'm like, this isn't what I went to school for. This isn't what I want to be doing. I want to do therapy. I don't want to, you know, cook chicken nuggets to feed
or you have to do rounds.
Yeah.
You know, you have to like make sure everyone's in their bed by a certain time, like like doing rounds if you're in residential.
Yeah.
Right. There's
sure.
I think, you know, that is another kind of cool piece to the field, though, is that there's so many different forms, right? And some people might really like the, you know, I'm just on the floor and I get to know people in a different context, or, you know,
or doing like medical social work, where it's more like crisis management.
Right. Mm-hmm. So there's so many different, you get to figure out, what do I like more? What what's going to fit for me, and you kind of have a little bit more choice in that.
Yeah.
You're not so stuck in one thing. And you can use that skill set in so many different aspects and, different avenues.
The last thing that I think we want to end on, it's a big one. It's
I just
something
rolled my eyes.
yeah. Well, people can't see that, Micaela. She did roll her eyes. It's getting a doctorate. Is it worth it? No one really told us about this either. We're in it right now. So, we're both doctoral candidates. We're working on our dissertation. We have maybe a few people that we know who completed their doctorate. There's a lot of things with it. This is also newer, I would say. So we're getting our PsyD in MFT, which is different. And not a lot of programs offer that. A lot of PsyD or PhDs are in clinical psychology.
So basically what this means is we're a doctor of psychology, or we will be. And
specializing in MFT.
We can be licensed as a psychologist as well. So we could be dually licensed as an MFT and a psychologist. The only catch is, which no one told us either, is that you have to do separate hours.
Starting your hours all over.
Yeah. So we're in California, so we have to do 3,000 hours to be licensed as MFT. And then it would be another 3,000, right?
Yeah.
As like a
clinical psych.
tech or something, right? And so
psych assistant.
Okay.
I think that's what it's called. We obviously did not look into this.
We clearly don't know what we're talking about because no one told us.
Yeah. Well, that wasn't the goal of why we got our doctorate anyway.
No, but I think especially this is a common question of like, should I go further? I've had colleagues and friends be like, "Oh, I've been so interested. I've been thinking about going back to school to get my doctorate."
Run away.
I think you really have to do a pros and cons and consider, what are you going to be doing with your doctorate that's different than with your master's.
Right. Because you can practice with your master's.
If you just want to see clients and do clinical work, I would say it's not worth it.
It's not. You don't need it.
The time and the money you're going to spend, you're not going to make that much more money just doing clinical therapy stuff.
Yeah. I think a lot of our colleagues who are getting their doctorate have bigger goals. They, not that the goal of just doing clinical work is not big, but I think, well, maybe big's not the right term. They want to branch out. So they don't want to just do clinical work. They want to teach, or they want to open their own agency. They want to develop their own theory. We have someone like that. I think they have other things in their mind about what they want to do.
You really like research, and that's what you want to focus on, or you want to be the director of something, some clinical director, right? That's when I would say it might be worth it for you to get, especially if you want to teach at the university, right? You have to, unless you're doing like at the community college level, then I think as a master's level you can teach.
You can teach at a master's level at university, but I think there's limitations on what you can teach.
Right.
Like, you can't be an adjunct or...
Yeah, if you're wanting to help, if you're wanting to be a professor and you're wanting to help other students and work on their dissertations and do research, and then that might be for you, right? And I would say considering which kind of doctoral program would be very important as well.
Yeah, what's required of you in your doctoral program. Like for our program, we need to do an exam, and then we also need to do a dissertation
and it's
an
not,
internship.
And it's not just a comprehensive written exam. We have to film ourselves doing therapy and write
to defend
a big paper on it. Yeah, so a lot of work goes into this. So it's not worth it if you're doing it because you want the letters behind your name and you want your friends to call you doctor.
Yep.
It's just not worth it. And it's not worth it if you're wanting to just open your own practice or work in, community mental health and doing therapy, which there's nothing wrong with that. Right. But it might not be worth it for the doctoral.
Spend the extra time and money.
It's expensive, you guys.
It's so expensive.
And you know what? I am going to make my friends call me doctor just because it was so hard.
I know. I told my husband this. I was like, honey, after all of this is done, like, I expect you to call me Dr. Pim for like the next year because I worked so hard on it.
Yeah. And, you know, this is a big decision. I think I actually had this conversation with my husband too before we got, I think it was before we got married that I was accepted into the program. And we had to
yes, you guys were engaged. I remember.
Yeah, it was like months before our wedding.
Yeah, I remember you filling out the application.
And I hadn't accepted the offer yet. Like, I went and I did the interview and I hadn't accepted anything yet. And I sat down with him and I said, like, this is going to affect you in a major way, right? And financially, this is your debt too. Like, are you okay if I do this, right? And so I think even considering that of like, this is a big decision. It's not an individual one, especially if you have a family or a spouse or a partner or whatever, right? It's a big commitment. And there's a reason why a lot of people don't finish. They start and they don't finish, which, again, there's tons of research on that.
It's not just a financial commitment too. I think it's an emotional commitment too.
Oh yeah, there's tons of research on that as well, of like the mental health of a doctoral student.
Yeah,
which is a little daunting.
I get by through memes.
Yeah, but I think that's something really to consider, and that's something that's not talked about because when you're in the university and you know you're there for your master's and you're thinking about continuing, your professors are going to push it, right? I mean, school, I hate to say it, it's a business.
It is.
Right? And people aren't necessarily going to turn you away and say, no, that's crazy talk. Don't do it. Run away. Right? They're going to encourage you. And I think that's always been something that stuck with me is that I've always thought of, oh yeah, education is a good thing. More education, more education, more education. Yeah. And it's not for everybody, especially at this level.
I think academia always... Again, I can talk about this for a very long time, always pushes for higher education. So when you're
like
getting
multi-level marketing.
Yeah. So like when you're in your bachelor's, right, it's like, yeah, earn a master's. And then when you get your master's, it's like, earn your doctorate.
Right. At the same time, I do think it opens up doors. You know, I think that some people are looking for doctoral level clinicians as well. I think it does.
Oh, for sure.
I think it does open up doors for different avenues. Like, you know, say I want to do a little bit of teaching and a little bit of clinical work and, you know, or I want to be in more of a supervisor role, whatever that is. I think to mix things up, I think it's going to be something that could be really helpful.
I would say, you know, I know you just mentioned don't do it for the title, but I would say it does make somewhat of a difference now that I'm in like a private practice realm. I would say the general public don't really know the difference between a psychologist, psychiatrist, a therapist, MFT, LCSW, LCCC.
Social work. Yeah, they don't know all those.
They don't know the big difference between all of these. And there have been times in my group practice where, you know, I would be a better fit for a certain client, but they specifically want Dr. So-and-so because of the title. And, you know, the person who like hands out the cases kind of have to explain like, no, this isn't really their specialty. I understand you want Dr. So-and-so, but they're not really going to be able to address the things that you need.
They actually don't work with kids at all.
Yeah, I think this person might be a better fit for you. And I've had clients sometimes come in and ask me, so do I call you doctor or not? Or they still call me doctor even when I correct them. So I think the title does mean something. You know, and of course you can't practice under false pretenses. So I always correct my clients and tell them, you know, I'm still a doctoral candidate or whatever. But, you know, I think it does mean something to the general public. And I mean, I think even for my family who aren't so in tune with therapy, still don't really quite understand or grasp the idea of it. For them, they think I'm wearing a white coat in a hospital,
In a lab.
or prescribe medications. They always send me their results of their recent medical exam, and I'm like, I don't know what this means. So
Not that kind of doctor.
Different kind of doctor. So I think it does mean something to the general public out there. Of course, you as a clinician would have to explain to them what the specialties are, what is your scope of practice and whatnot.
I think that's one of the biggest things that I've taken away from our program. Like the dissertation, like that's super stressful. But as far as becoming a better clinician, becoming more informed and just digging a little deeper into theory and, being a therapist, I think it really has set me up for success in that regard.
Yeah.
Because the master's, it's kind of like, okay, yeah, we
It's a
spend
quick
one day,
overview.
we spend one day on narrative therapy. We spend one day on satire. We spend one day, and that's it. And it's a big blur by the end of the 2 years.
Yeah.
And so we were able to really delve in and read original work from the original authors.
Not just like paraphrasing things.
In your big textbook. Right, referencing everybody. Like we got to read original stuff, and that was part of our discussion, and it was a lot more critical thinking, which I actually enjoyed. Yeah. I like learning, so that was neat.
I enjoyed all the classes that we've taken. I think, I feel like it's helped me take the licensure exam. I did feel very prepared when it was time to take my licensure exam because we had spent not just one day over with an overview of a theory. We actually delve into the theory. How was the model first came to be? We had to read original works. We had to really put ourselves in the literature, have very critical discussions about it. So I think it did help me in that sense of being a better clinician, like you said.
Yeah, I agree. It's also like fresh in your mind. It's not like, oh yeah, 3 or 4 years have passed and now I'm going to take the exam and I haven't been in school for however long, right?
Yeah.
So I think that's another perk of continuing, but by all means, that's not the only reason you should do it. And you have to really think, how can I make this degree work for me and make it financially and time-wise have it make sense, right?
For sure.
So
yeah,
heavy stuff. But we are interested in what are some maybe things that you've learned along the way or come across that you wish you would have heard early on or nobody told you. I'm
Please
sure you have
write
some.
in. Please tell us. We would love to know. I'm sure people who have been in the field for many years, or even people who are considering coming into the field, if you're listening to this, we'd love to hear from you if you have any more questions.
And we might have a part 2 on this with feedback from all of our listeners on things they would have liked to have known.
Yep. All right.